Today we're going to look at treating the older clients. And if you've got an older client, they are going to have age-related changes. And this could include thinner, less elastic, more fragile skin, altered pain perception, even because of damage to the nervous system or because of cognitive reduction. Circulatory changes, so the circulatory system might not be as efficient and they might, for example, get cold feet more often. Visual and auditory impairments and mobility limitations. Older adults often have comorbidities, so this is just a way of saying more than one condition. And the problem with this is the treatments for the conditions don't necessarily align, and the aftercare advice can be totally different for different treatments. So it can be harder for the individual to look after their different conditions. Um, we're working on the feet, so all the hands, but let's look at the foot health considerations. If someone's got diabetes or that can or neuropathy, and diabetes can lead to neuropathy, that with the thinner skin, you get a loss of subcutaneous fat. So that's the fat under the skin, and so the feet can be very bony. You get fungal or thicker nails, structural and joint changes. So you can have arthritis, which thickens some of the joints. You can have lots of different problems with the feet, which can actually make it harder to work out exactly where some of the reflexes are. The reduced circulation can lead to cold feet. You can have corns, calluses, and hard skin, all which can make it harder to work the reflexes you need to. Edema, you can have swelling, and again, so that can stop you feeling all the bony prominences that help you find the reflexes. Reduce mobility is getting in and out of your couch, but also if you're doing an ankle rotation, the client may not be able to have a lot of movement in that ankle. And quite often, because of mobility problems and vision problems, it can be harder for them to get down and look after their feet. Now, looking after your feet is really, really important. And I've got some stats here about diabetes. The reference for this is in the text section of this video. And this is looking at 2017 to 2020. And that is looking at, if I just go to major amputations, so we're talking about 8.1 per 10,000 people per year. Now, that is really high. Now, part of the problem is if someone has got diabetes, they will have maybe one um, foot review a year. If they're low risk, they may only have one foot review every other year. But because of things like neuropathy, clients may not feel if they've got a cut or a problem with their feet. And so these can very quickly get infected, become out of control. So I think as reflexologists, we can do a really, it's a really good safeguard actually for us to just check the feet over. And if there are any problems with the feet at all, make sure the client is aware of them because they might not be. They might, something might look angry and you might think, oh, I've got to cover that. But actually, if the client's not aware of it, it may get infected. I was treating one lady. She arrived for her treatment, took off her shoes, and on the left foot, all her toes were completely black. So obviously, I didn't treat. I sent her straight to the doctors, and she got seen, and she was actually fine. They actually changed her heart medication, but she was actually blind as well as in her 90s, and she couldn't really get down to see her feet anyway. So she'd got no way of knowing they were black, and she couldn't feel the differences in her toes. So without that, she could have quite easily ended up losing her foot, which would have really hurt her mobility. So this isn't just something that's nice to have. This is something that's really important, and it's for all clients, but especially for the older clients. Thinking about younger clients, I have noticed moles, which I've, with the client's permission, taken a picture and popped in their notes. And when these moles have changed, I will tell them that this looks different. And I've had several people that they've had the moles removed because of skin cancer. So this is something that we can do and is a really good service. Cognitive decline and hearing loss. So clients may forget aftercare advice. So it's good for them to have written instructions or handouts. It can be good to just remind them the day before their session so that they don't forget. Um, and hearing loss. Now, when you're doing a consultation and the client's just going, yes, yes, they may have hearing loss, but they're embarrassed to admit up to it. So if they've got hearing loss, if they're just nodding and saying yes, that doesn't mean they've heard your question. So make sure you speak very clearly to them and that they can see your face and your lips. And just be aware that hearing loss is very common in the older client. Hydration. Now, this is a big problem. You think, well, hydration, it's doesn't matter if people don't drink enough, but actually, chronic underhydration can lead to fatigue, confusion, constipation, and hospitalization. So again, there's a good reference for this of a study that was carried out, which is in the text part of this section. And so I would say encourage fluids before or after treatment. And if your client seems confused, then I think you need to think about, do you need to tell anybody? Now, when I have my consultation forms, I have an emergency contact and I get the client's permission to contact that person if there's an emergency or if I'm worried about the person. So I do this when I'm doing my consultation. By the time your client is with you and confused, it's too late to get permission to contact somebody. And I have contacted people several times, not often, but enough that it's worth it to get this information. So this is, again, it's when I do my initial consultation, I get an emergency contact and I get permission from the client to contact them. So yeah, hydration is a big issue for older people. Emotional and social support. So we know reflexology can reduce stress and improve well-being. It also offers social interaction and emotional comfort. Now, I really like hand reflexology for my clients that are older, but it's up to them. But I think if you are working on the hands, you are closer to them. They can tell you about their life. I had a client who every time she used to ask me if I used to remember the war. And I know you can't see a picture of me now, but I'm not old enough to remember World War Two. But also it's an opportunity if you are worried about them for you again to just speak to their emergency contact and let them know you're worried about a particular area. So, understanding aging and individual health needs is key. So, if the client has different morbidities, then you need to understand the effect of those morbidities on the client. And you need that to adapt your treatments. Um, Adapt treatments for safety, comfort, and effectiveness. So safety is first. You know, as the client gets older, getting into a lymphoma might be hard. So you've got to make sure they're safe. You've got to make sure they're comfortable. They might need extra bolsters. And you want the treatment to be effective. And to do that, you've got to fully understand their conditions. Reflexology can support both physical and emotional well-being. And I think especially older people that are more isolated, that don't maybe see as many people, it can be really, really beneficial for them. Thank you.